there, deep divers. Ready for another deep dive?
Always. What are we tackling today?
Today, we're diving headfirst into some proposed reforms for the U.S. Department of Health and Human Services.
You mean HHS?
Yep, exactly, HHS. And trust me, this isn't just another dry policy review. We're talking about potential changes that could dramatically impact healthcare for all Americans.
Okay, now you've got my attention. Where are we starting?
Well, we're taking a deep dive into a document that lays out a conservative vision for the future of HHS. It gets into some pretty hot-button issues, but remember, our goal here is to break it all down for you, not to tell you what to think.
Right. We're all about neutral analysis here.
Yeah.
Just the facts, ma'am.
Exactly. We're your unbiased guides to the complex world of healthcare policy. So let's start with the basics. HHS, as you know, is a massive federal agency.
And I mean massive.
Yeah. It's got a budget of, get this, $1.6 trillion.
Wow.
Right. That's more than the entire economies of many countries.
Okay.
And it touches pretty much every aspect of our lives, from healthcare to social services.
Yeah, you name it, they're probably involved in it.
Exactly. Now, this document we're diving into, it argues that HHS has strayed too far from its core mission and has become too powerful.
Okay, I'm intrigued. Tell me more.
So they're basically saying that HHS has become this behemoth, this bureaucratic giant that's interfering too much in our lives, and they're calling for some pretty radical changes to rein it in.
Radical how? Give me the rundown.
So the document lays out 5 overarching goals for HHS, and these goals really reflect a deeply conservative worldview, which I think is important to keep in mind as we go through this.
Okay, that makes sense. So what's goal number 1?
Goal number 1 is all about protecting life, conscience, and bodily integrity.
Okay, so right off the bat, we're getting into some pretty weighty issues.
Yeah, this is where their stance on abortion and things like that come into play. They're basically saying that life begins at conception and that HHS should prioritize the protection of life from the very beginning.
I see. So this is about more than just healthcare policy. It's about their fundamental beliefs about life and morality.
Exactly. And it really sets the stage for a lot of the specific policy recommendations that come later in the document. But before we get ahead of ourselves, let's move on to goal number 2.
All right, shoot. What's next on their list?
Goal number 2 is all about empowering patient choices and provider autonomy.
Okay, that sounds pretty straightforward, but I'm guessing there's more to it than meets the eye.
You bet. They're basically advocating for a more free market approach to healthcare.
Okay, so less government intervention, more individual choice.
Exactly. They want to give patients more control over their healthcare decisions, more control over their healthcare dollars, and they want to reduce the role of government in healthcare.
Interesting. So less regulation, more competition.
You got it. They argue that this will lead to lower costs, better quality, and more innovation.
It'll be interesting to see how they propose to achieve that. What's next on their agenda?
Okay, this next goal is where things get really interesting, especially given all the recent debates and controversies we've seen.
Hit me with it.
Goal number 3 is promoting stable and flourishing married families.
Okay, so now they're venturing beyond healthcare and into the realm of social policy.
Exactly. And they're pretty clear about their stance. They believe that traditional 2-parent families are the foundation of a strong and healthy society, and that HHS policies should reflect that belief.
I see. And I imagine this is where they get into their views on marriage, family structure, and maybe even things like LGBTQ plus issues.
You're catching on quickly. They're basically saying that HHS should prioritize policies that support traditional family structures.
This is going to be controversial.
Oh, absolutely. This is a hot button issue, and they're not shying away from it. In fact, they're really leaning into it.
It's certainly a different perspective than we're used to hearing from the government.
Yeah.
Okay, what's next?
All right. Goal number 4 is something I think will resonate with a lot of people, especially given what we've all been through in recent years.
Okay, you're really building the suspense here. What is it?
Goal number 4 is preparing for the next health emergency.
Here we go. I was wondering when they'd get to the COVID-19 pandemic.
Right. And let me tell you, they don't hold back. They're pretty critical of how the government handled the pandemic, and they offer a very different approach for the future.
Okay, I'm all ears. What's their take?
So their big thing is they want less centralization of power, more individual liberty, and a whole lot more transparency when it comes to public health emergencies.
So less top-down control, more emphasis on personal choice, even during a crisis.
Exactly. They're basically saying that the government overstepped its bounds during the pandemic and that we need to make sure that doesn't happen again.
Interesting. So more checks and balances, more accountability.
Precisely. Now, on to their final goal, and this one's all about accountability and transparency.
Okay, let's wrap this up.
Goal number 5 is instituting greater transparency, accountability, and oversight.
Sounds pretty self-explanatory.
Yeah.
But what does it mean in practice?
They're basically saying that HHS has become this big, opaque bureaucracy, and they want to shine a light on everything it does.
So more openness, more scrutiny.
Exactly. They want to make sure that HHS is accountable to the American people, that it's using taxpayer dollars responsibly, and that there are no conflicts of interest influencing its decisions.
I think most people would agree that more transparency and accountability are good things.
Absolutely. Now, these are just their 5 overarching goals. We haven't even gotten into their specific recommendations for each agency within HHS yet.
Well, don't leave me hanging. We've got the 5 pillars of their vision. Now let's get into the specifics. Where do we start? All right, deep divers, are you ready to dive into the specifics? Because we're about to get into the nitty-gritty of how this document proposes to reshape HHS agency by agency.
I'm strapped in and ready for the ride. Where do we start?
Let's kick things off with an agency that's been in the spotlight a lot lately, the Centers for Disease Control and Prevention. You know them, you might love them, you might not love them. But either way, the CDC is a major player in the HHS world.
That's an understatement if I've ever heard one. So what's their grand plan for the CDC? What needs fixing there?
Well, they don't hold back the punches. They're calling for some pretty major changes, starting with a complete restructuring of the agency.
Okay, now you've got my attention. Restructuring how?
They actually want to split the CDC into 2 separate agencies.
Whoa, whoa, whoa. Hold up. 2 CDCs. How would that even work?
So their argument is that the CDC is trying to wear too many hats. They're collecting and analyzing data, which should be a purely scientific endeavor, but they're also issuing public health recommendations, which often become politicized.
Yeah, I can see how that could get messy. Science and politics don't always mix well.
Exactly, and that's what they want to avoid. So they're proposing to create one agency that focuses solely on data, just the cold, hard facts, and then a separate agency that would handle the policy recommendations based on that data.
Interesting. So like a separation of powers within the CDC, keeping the science separate from the policy decisions.
Precisely. They believe it'll ensure that data is presented transparently and that it's not being manipulated or spun to fit a particular agenda.
Okay, I'm starting to see their logic here. So no more CDC pronouncements on mask mandates or vaccine guidelines. That'll all come from this new policy-focused agency.
That's the idea. They want to limit the CDC's authority to issue those kinds of prescriptive guidelines. They believe those decisions should be made between individuals and their doctors without the CDC's involvement.
I see. So more individual liberty, less government overreach.
Exactly. And it ties back to their goal of empowering patients and providers. They want to shift the balance of power away from the federal government and back towards individuals and their healthcare providers.
It's a pretty big shift. Now, what about all those concerns we hear about the CDC, lack of transparency, potential conflicts of interest, that kind of thing? Do they address those at all?
Oh, absolutely. In fact, they hit those points hard. They want to address the issue of the CDC accepting funding from pharmaceutical companies.
Yeah, that's always a bit of a red flag, isn't it? When the agency that's supposed to be regulating an industry is also taking money from that industry.
For sure.
Yeah.
And they want to prohibit that practice altogether. They argue it creates a conflict of interest that could potentially influence the CDC's recommendations.
It makes sense to me. It's like having the fox guard the hen house.
Right. They also want to see a massive overhaul of the CDC's data systems. They're calling for more robust, real-time data collection and analysis, particularly when it comes to infectious diseases.
Yeah, better data would certainly be helpful, especially given how important data has become in tracking and responding to public health threats.
Absolutely. Oh, and there's one more data point they're particularly interested in tracking more closely.
Oh, do tell.
Abortion. They're calling for improved abortion surveillance. They want states to be required to report detailed data on every abortion that's performed.
Wow, that would be a huge shift in how we collect data on abortion.
It would be monumental. It's all part of their goal to promote what they call transparency on this issue.
Okay, so it seems like the common thread here is more data, more transparency, less federal control, and more power to individuals and states.
You nailed it. And those themes continue as we move on to another agency that's been making headlines, the FDA.
Ah, the Food and Drug Administration. They've had their hands full lately, haven't they?
To say the least. And this document doesn't let them off the hook either. They have a lot to say about the FDA, starting with the cost of prescription drugs.
I think we can all agree that something needs to be done about those prices. They're out of control.
Tell me about it. Well, they're proposing to tackle this issue by focusing on generic drugs.
Makes sense. Generics are usually way cheaper than the brand name stuff.
Exactly. But they argue that pharmaceutical companies are using all sorts of tactics to delay the entry of generics into the market. They essentially want to break those monopolies and give consumers more affordable options.
Okay, I like where they're going with this. So how do they propose to make that happen?
Well, they want to close those loopholes that allow companies to game the system and keep those cheaper alternatives off the market for as long as possible.
More competition, lower prices. That's the goal, right?
Right. Now, another big area of focus for them is the FDA's approval process, which they argue is way too slow and burdensome.
Yeah, I've heard that complaint before. Too much red tape, not enough urgency.
That's their argument. They're especially concerned about the process for approving new medical tests, like those at-home COVID tests that became so crucial.
Yeah, that whole situation really highlighted the need for a faster, more flexible approval process.
Absolutely. And they argue that the current system is stifling innovation and preventing potentially life-saving treatments from reaching the people who need them.
So they want to streamline the process, cut through the bureaucracy, get those treatments to patients faster.
You got it. And while we're on the topic of speed and efficiency, they also want to tackle the issue of drug shortages.
Oh, right, like those shortages of antibiotics and other essential medications we've been seeing.
Exactly. They want to incentivize manufacturers to invest in more reliable production facilities here in the U.S. to prevent those supply chain nightmares from happening in the future.
Smart move. No one wants to be caught in a situation where they can't get the medication they desperately need because of supply chain issues.
No kidding. But here's where things take an interesting turn. Remember how we talked about their stance on abortion earlier? Well, they take direct aim at the abortion pill, mifepristone.
Ah, so this is where their pro-life values come back into play.
Exactly. They argue that the FDA's approval of mifepristone was flawed from the beginning, and they're calling for a complete reversal of its approval.
Wow, that's a bold stance to take. What's their reasoning behind that? Safety concerns?
Safety concerns, concerns about the increasing prevalence of mail-order abortions. They want tighter regulations on the drug's distribution and ultimately want to see it taken off the market altogether.
I see. So it's a multi-pronged approach to align the FDA with their pro-life stance. What else?
Well, this might surprise you, but they also want to make it easier to import vaccines.
No, that's unexpected. I wouldn't have seen that coming from a group with such strong pro-life views.
Right. But they argue that many Americans are seeking alternative vaccines, those not derived from aborted fetal cells. They believe it should be easier to import these alternative vaccines to give people more options.
It's like they're trying to find a compromise within their own ideological framework.
Exactly. It's more nuanced than you might expect. And lastly, just like with the CDC, they're taking aim at conflicts of interest within the FDA. They call out the revolving door between the agency and big pharma, where FDA reviewers often end up working for the very companies they were regulating.
Yeah, that's always a bit of a head-scratcher. How can you be impartial when you're so closely tied to the industry you're supposed to be overseeing?
Exactly. So they want to see a mandatory cooling-off period to prevent this and want stricter regulations on direct-to-consumer drug advertising. They argue that Big Pharma has way too much influence over how healthcare issues are portrayed in the media.
It's all about transparency and leveling the playing field, right?
You got it. So to sum it up, their vision for the FDA is more transparency, less Big Pharma influence, and a greater focus on consumer choice. Okay, we've tackled the CDC and the FDA 2 down, and oh boy, do we have a lot more to go.
Bring it on! What's next on our HHS agency tour?
Get ready for the National Institutes of Health, better known as the NIH. This is the big kahuna of medical research.
The NIH, they fund a ton of research, right? I'm guessing this is where things get really interesting.
Oh, you bet. And they don't disappoint. First up on their list of NIH reforms is addressing those ethical concerns surrounding fetal tissue research.
Here we go again. This is a recurring theme throughout this entire document.
It's central to their worldview, and they don't mince words. They want to see a complete ban on all research that involves fetal tissue.
Wow, a complete ban. That's a pretty radical stance, even for a group that's staunchly pro-life.
They're not messing around. Their argument is that fetal tissue research is both morally wrong and scientifically unnecessary. They believe there are plenty of alternative research methods that don't rely on fetal tissue.
So they're not just trying to restrict this type of research, they want to eliminate it entirely.
You got it. And this is a great example of how their values are driving their policy prescriptions.
It's a complete paradigm shift in how certain types of research would be conducted.
Right. Now, just like with the CDC and the FDA, they're concerned about conflicts of interest at the NIH.
Let me guess. Big Pharma rears its ugly head again.
You know it. They specifically call out the NIH's ownership of patents on pharmaceutical products, like the Moderna COVID-19 vaccine.
Oh, wow. I didn't know the NIH actually owned patents on drugs and vaccines.
They do, and this document argues that it's a conflict of interest.
I can see why. It's like they're profiting from the very research they're funding.
Precisely. And they believe it could be influencing research priorities and hindering innovation. Their solution: they want to see the NIH divest from these patents and promote more competition in the research world.
So less government involvement, more private sector innovation. It's a common theme, isn't it?
It's their recipe for pretty much every aspect of healthcare. Oh, and they don't stop there. They also criticize what they call woke policies at the NIH, like those gender quotas for conferences.
Right, those initiatives aimed at promoting diversity and inclusion in the sciences.
Exactly. But this document argues that these policies are discriminatory and promote biased research.
So again, we're seeing their values driving their policy recommendations.
Absolutely. They want to see those policies scrapped entirely. Okay, are you ready to tackle the giants of HHS? The Centers for Medicare and Medicaid Services, better known as CMS.
CMS. Now we're talking about Medicare and Medicaid, two programs that impact a huge chunk of the American population. I'm ready. Let's do it.
Buckle up, because it's about to get complicated. And this document doesn't hold back. They're calling for some major changes to both Medicare and Medicaid.
All right, lay it on me. What's their grand vision for Medicare?
They outline four main goals, actually. They want to see patients more in control of their health care, want to cut back on all the regulations they say are bogging down doctors, want to make sure that Medicare can actually survive in the long run, which, let's be honest, is a big concern for a lot of people. And of course, they want to crack down on all that waste, fraud, and abuse that always seems to plague these big government programs.
Sounds like a tall order. So where do they even begin?
Well, they propose a mix of regulatory and legislative changes, kind of a 1-2 punch to get Medicare back on track.
Okay, so what's on the regulatory front?
They want to bring back some of those Trump-era regulations that the Biden administration rolled back.
Ah, so it's back to the future for Medicare.
In a way, yeah. For example, they want to reinstate the Medicare coverage of innovative technologies rule, which was designed to make it easier and faster for seniors to access new, cutting-edge treatments and medical devices.
Makes sense. I mean, who wants to be stuck with outdated technology when there are new, potentially life-saving treatments out there?
Right. They argue that the current administration has made it harder for seniors to access these innovations, and that their approach will lead to better care and better outcomes.
Okay, I'm following. What else?
Well, they also want to promote what they call site neutrality when it comes to Medicare reimbursements.
Site neutrality. I'm not familiar with that one. What is it?
Basically, it means that Medicare would pay the same amount for a procedure, regardless of whether it's done in a hospital or an outpatient setting.
Oh, I see. So it wouldn't matter where you got your surgery or treatment, you'd pay the same amount.
Exactly. Right now, it's often way more expensive to have a procedure done in a hospital, even if it could be done safely and effectively in a less expensive outpatient clinic.
Yeah, that never made much sense to me. It seems like it should be about the quality and necessity of the care, not the location.
Exactly. And they argue that this site neutrality approach would not only save Medicare money, but also give patients more choices and flexibility in where they receive care.
Okay, that makes sense. So more patient choice, less bureaucracy, and a focus on cost effectiveness. I like it. Now, what about the legislative side of things?
They have a whole laundry list of legislative reforms they'd like to see happen.
Hit me with your best shot.
One big one is removing those restrictions on physician-owned hospitals. They argue that these hospitals often provide higher quality care and more competition in the system.
Interesting, because right now those big hospital systems seem to be gobbling up everything in sight.
Exactly.
Yeah.
This would be a way to push back against that trend and give patients more options. They also want to shake things up when it comes to Medicare Advantage plans.
Okay, Medicare Advantage. That's where you can choose to get your Medicare benefits through a private insurance company, right?
You got it. And they're big fans of Medicare Advantage. They actually want to make it the default enrollment option for Medicare beneficiaries.
Whoa, now that's a big change. So instead of being automatically enrolled in traditional Medicare, you'd be automatically enrolled in Medicare Advantage unless you opted out.
Precisely. It's all about giving patients more choices and control over their health care.
I see. And I bet the private insurance industry is loving this idea.
Oh, I'm sure they are. And speaking of private industry, they also want to repeal that drug price negotiation program that was part of the Inflation Reduction Act.
Oh, right. That was a big deal for the Biden administration. They made a big show of taking on big pharma and lowering drug prices.
Yep. But this document argues that it's actually going to end up hurting patients in the long run because it'll stifle innovation and limit access to new medications. They'd rather see market-based solutions to bring down drug costs.
So less government intervention, more free market competition, that's their prescription for lower drug prices.
Exactly. They believe that a free market is the best way to drive down costs and spur innovation. Okay, are you ready to tackle Medicaid?
Bring it on! Medicare, Medicaid, it's all Greek to me.
Yeah.
Just kidding. But seriously, let's dive into their Medicaid proposals.
Okay, so Medicaid. Where to even begin? They argue that while it's meant to help those in need, it's become way too big, too expensive, and frankly, not very effective in actually helping the people it's supposed to be helping.
So similar criticisms to those they have about Medicare. Too much government, not enough efficiency.
Exactly. They argue that Medicaid's expansion under the Affordable Care Act, while well-intentioned, has backfired.
How so?
They say it's led to skyrocketing costs and fewer resources for the truly needy.
It's like they're saying that by trying to help more people, Medicaid has actually ended up hurting the very people it was designed to help.
That's their argument in a nutshell. Plus, they're very concerned about those improper payments and all the fraud that seems to plague the system. They say it's a huge waste of taxpayer dollars.
Yeah, that's a problem with any big government program, isn't it? It's hard to keep track of where all the money is going.
Tell me about it. So what's their solution for fixing Medicaid? Well, they have a whole bunch of ideas.
Like what? Give me the highlights.
One of their big things is giving states more flexibility in running their Medicaid programs. They want to loosen those federal strings and let states tailor their programs to their specific needs and priorities.
There's that decentralization theme again. It's like they have a fundamental distrust of the federal government.
It's definitely a recurring theme in their approach to pretty much every issue. They also want to ditch the current fee-for-service model for Medicaid.
Fee-for-service? You mean where doctors and hospitals get paid for every service they provide, regardless of whether it actually helps the patient?
Exactly. They argue that it just incentivizes providers to do more, not necessarily do better.
It's like going to a mechanic who gets paid for every part they replace, even if your car doesn't need it. Not exactly a recipe for quality or affordability.
Right. So instead of this fee-for-service model, they'd rather see a system that rewards value and outcomes.
Interesting. So you mean paying providers based on how well they actually treat their patients and keep them healthy?
Exactly. They believe it would lead to better care and lower costs in the long run.
I can see the logic there. It's like the old saying goes, an ounce of prevention is worth a pound of cure. What else?
Well, they also propose some other things, like tightening up eligibility requirements for Medicaid, making sure that only those who truly qualify for the program are actually enrolled.
I'm guessing that'll ruffle some feathers.
Oh, definitely.
Yeah.
But they argue that it's necessary to ensure the long-term sustainability of the program. And they also want to give beneficiaries more personal responsibility for their healthcare decisions.
Okay, what does that look like in practice?
They're talking about things like work requirements for able-bodied adults, maybe even premiums for higher-income enrollees, and giving people more options to choose their healthcare plans.
Interesting. So essentially injecting more free market principles into Medicaid.
Exactly. Now, here's a really radical idea they propose. They want to allow states to use Medicaid funds to help people buy private insurance.
Whoa, that's a whole new level of privatization. Basically giving people a voucher to go shop for their own healthcare plan instead of being stuck in traditional Medicaid.
That's the gist of it. It's a pretty dramatic departure from how Medicaid currently works.
It would be. Okay, so they've got big plans for Medicaid, more state control, more individual responsibility, more private sector involvement, basically a complete overhaul of the program as we know it.
They're not afraid of a little disruption, that's for sure.
Okay, so we've covered the heavy hitters, CDC, FDA, NIH, Medicare and Medicaid. What other parts of the HHS universe are they looking to shake up?
Well, they also have their sights set on the Administration for Children and Families, also known as the ACF.
That's the agency that handles things like Head Start and TNF, right? All those programs aimed at helping children and families in need.
That's right. And let me tell you, they don't hold back when it comes to the ACF.
Oh boy, here we go. What do they have in store for the ACF?
Well, for starters, they want to overhaul the Temporary Assistance for Needy Families program. You probably know it as TNF.
PNF, right. The program that replaced welfare back in the 90s.
Exactly. So they want to see stricter work requirements for TNAM recipients. And there's a big emphasis on promoting marriage and fatherhood.
There's that focus on the traditional family structure again. They really want to use these programs to incentivize what they see as the ideal family unit.
It's a common thread throughout this whole document.
Okay, what else?
Well, they don't just want to reform Head Start. They want to get rid of it completely.
Whoa, 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 hold up. Eliminate Head Start entirely. Isn't that one of those programs that everyone generally supports?
You'd think so.
Yeah.
But they argue that it's ineffective, too expensive, and doesn't really provide any lasting benefits for kids.
Wow, that's a pretty harsh assessment. So I'm guessing they want to redirect those funds elsewhere.
You know it. They're
Yeah.
calling for defunding Planned Parenthood and giving those funds to pro-life clinics instead.
It's all about aligning spending with their values, right? They want to support programs that reflect their worldview.
Exactly. They'd rather see that money go towards organizations that promote their vision of family and life.
I see. So, big changes for the ACF, shifting priorities, redirecting funds. It's all part of their broader effort to reshape these agencies in their image.
You got it. Oh, and here's another big one. They want to move the Office of Refugee Resettlement.
The Office of Refugee Resettlement, what do they handle?
They're responsible for resettling refugees who are admitted to the United States. Think housing, job training, that kind of thing.
Okay, so what do they want to do with this office?
They want to take it out of HHS and move it under the Department of Homeland Security. Their reasoning. They argue that refugee resettlement is more about immigration and national security than it is about health and human services.
I see. Streamlining the government, putting all immigration-related matters under one roof. It makes sense from an organizational standpoint.
Right. They also want to revamp the Office of Child Support Enforcement with a focus on strengthening marriage and encouraging fathers to be more present in their children's lives.
There's that emphasis on fathers and traditional family structures again. It's like a broken record. But I guess that's their prerogative, right? To push for policies that align with their values.
Exactly. They're entitled to their views, and this document is their way of laying out a roadmap for how they'd like to see HHS change.
Okay, so we've got a pretty good handle on their vision for specific agencies. But what about the big picture? What role do they envision for the HHS secretary in all of this?
Well, they definitely see the HHS secretary as a powerful position, one that needs to be held more accountable, especially after the whole COVID-19 situation. They want to limit the secretary's power, particularly during public health emergencies.
So they're reacting to what they see as an overreach of executive power during the pandemic.
Exactly. All those lockdowns, mandates, and restrictions. They weren't fans. They're concerned about that level of centralized authority and want to make sure that future public health emergencies are handled differently.
More checks and balances, less executive power. I'm sensing a pattern here.
You got it. They're also demanding greater transparency within HHS as a whole. They want to see more accountability and oversight, which, let's be honest, is never a bad thing.
Transparency is good, especially when it comes to something as important as healthcare.
Right. And, of course, they want to make sure that whoever's sitting in that HHS secretary chair shares their pro-life, pro-family values.
So they're not just looking for a competent administrator. They want a true believer, someone who will champion their cause.
Exactly. They actually call for creating a whole pro-life task force within HHS and appointing a dedicated representative for domestic women's health, just to make sure their perspective is represented at every level.
Wow. They've really thought this through, haven't they? They're leaving no stone unturned in their quest to remake HHS and their image.
No kidding. They have a vision, and they've laid out a very detailed plan for achieving it. Whether you agree with them or not, you got to give them credit for being thorough.
Absolutely. This document is nothing if not comprehensive. Well, deep divers, we've taken you on quite a journey today. We've explored the ins and outs of this conservative vision for HHS. From the big picture goals to the nitty-gritty details.
We've covered a lot of ground, and we've tried our best to present it all in a clear, unbiased way, even though some of these issues can be pretty controversial.
Exactly. Our goal here is to equip you with the knowledge you need to understand these complex issues and form your own informed opinions.
Because ultimately, this is about your health, your family, your future. These decisions will have a real impact on all of our lives.
Well said. So, deep divers, as always, we encourage you to do your own research, ask tough questions, and stay engaged in these critical conversations about the future of healthcare.
Because the future is now, and it's up to all of us to shape it.
Thanks for joining us for another deep dive. We'll see you next time.